Please click the like and subscribe buttons so that you can receive more of MAP's clinical pearls and technique videos.
G'day, Chris Showalter, Program Director for MAPS. As we've stated in the courses, lumbar rotation techniques are some of the most powerful techniques for managing issues in the lumbar spine. Most philosophies of manual medicine have them. Many of them are variants on a theme. Some of the critical errors we see people making is in the application of a true grade 3 lumbar rotation. One of the things we see, so you guys know how to set up from below and set up from above. We'll do that in a separate video. But in this situation, one of the things we see is that people mix up the concept of the 3-to-1 ratio. The 3-to-1 ratio happens naturally of itself. As the patient's hip is pushed forward, the shoulder lags behind. So for 3 units of movement that way, there's 1 unit of movement that way. One of the things we see in a grade 3 rotation is something like this. And that's not a movement that's going to make a patient feel comfortable or relaxed or confident in your abilities. That's too much counter rotation. In a true grade 3 movement, if you focus on the movement of my body, the movement's occurring from my body. So in comparison to the jiggles that I showed you before, now we have this nice, smooth, rhythmic, oscillatory lumbar rotation. And my palpation of his movement, of feeling for the amount of rotation coming through his shoulder, is just by my finger. This is how I often teach it, to show that we're not counter-rotating people with this movement. In fact, we've got our whole hand there and we're palpating for movement. Another quick clinical tip. Often when you rotate patients in this position, what happens? They get more rotation. So instead of changing this whole beautiful setup that you've put in, one of the tricks I like to use is to get underneath their pelvis, above their pelvis, and just rotate them back towards me. So that buys me all this rotation room down here. So now we can go back and continue with our rotation. And I haven't changed his setup from below and above. So just another little clinical trick to help you guys manage patients better. Thanks.